that we were concerned, the public health community, and many people were saying this, were concerned that it was at a time when personal protective equipment, including the N95 masks and the surgical masks, were in very short supply. That we were thinking we would run out of masks and other things for them. So the recommendation was not to wear a mask because of the shortage of it. Two things happened. One, it became clear that we had enough of the equipment, so there was no shortage.
Where are the gowns? Where's the PPEs? Where are the masks? Where are they?
We don't have enough. It's, one N95 mask for the entire shift.
What about a month or so, or 2 or 3 ago, when people were saying, you don't really need to wear a mask? Right now, people should not be walking. There's no reason to be walking around with a mask.
We've been warned over the years that, there's going to be a respiratory virus that's going to spread around the world, create a pandemic that is going to require significant increase in our PPE.
The problem with a pandemic of influenza is it lasts for a year or two. We will basically see, I believe, a collapse of the global economy as we know it, which means we're going to run out of those things. Things like medical supplies, drugs, masks, whatever. So yes, they'll work, but I don't have any belief that much of this will be available during a pandemic.
It became clear that cloth coverings that you didn't have to buy in a store, that you could make yourself, were adequate.
Well, those side vents are going to fill in. So in many cases where you've seen pictures of people with surgical masks on, it really is potentially as much cosmetic as it is real in terms of protection.
So they're kidding themselves. When
you're in the middle of an outbreak, wearing a mask might make people feel a little bit better, and it might even block a droplet, but it's not providing the perfect protection that people think that it is. And often there are unintended consequences. People keep fiddling with the mask and they keep touching their face.
You were saying that the issue with the mask is there just won't be enough.
There's two things. There won't be enough, and you need to have the right kind. Just a piece of cloth across your face, as we saw in many of the shots from Asia during the SARS epidemic, will not do that much to protect you.
So here's a new in-depth report directly from the CDC. This is a report on mask mandates. Here are the actual numbers from the CDC. Mask mandates were associated with a 0.5 percentage point decrease in daily COVID-19 case growths 1 to 20 days after implementation, and decreases of 1.8 percentage points after 100 days. Mask mandates were associated with a 0.7 percentage point decrease in daily COVID-19 death growth within 20 days, and 1.9% after 100 days. And it says this right here. It says this right here, just to be really clear. Daily case and death growth rates before implementation of mask mandates were not statistically different from the reference period.
Bro.
They were not statistically different. So you're looking at 0.7, you're looking at 0.5 to 1.9 across the board, on the high side of the scale. Now, let's contrast that with 9.5 million jobs lost, 4 million small businesses that will never reopen, a 93% increase in mental illness, people seeking help for depression, anxiety, and suicide rates at record highs. At certain point, you have to balance the risk-reward. How much is your life worth? I don't care, Bed Bath & Beyond, bitch. You can wear your mask. They don't believe it. If they thought it was like Ebola with a 50% mortality rate, where people went into where it was in Liberia, and it was like Samaritan's Purse, right? They wouldn't be in close proximity fighting. I would just snap that mask like the Bane hose. Like seriously, they're sitting there fighting with a piece of cotton, and they think that it's biological warfare. They're not afraid of it.